Chapter 62, Business Operating Systems. Business practices and the role of the business assistant. Greeting patients and answering the phone. Scheduling patients. Managing patient records. Managing accounts receivable and payable. Managing the recall and inventory control systems. Overseeing and monitoring practice marketing activities. Managing payroll. Presenting and making financial arrangements and overseeing insurance submissions. Standard Operating Procedure Manual might include new patient protocol, office communication procedures, staff policies, employment policies, office records, Health Insurance Portability and Accountability Act, Occupational Safety and Health Administration and Infection Control, clinical procedures, sterilization process protocol, room turnover protocol, lab shipping and receiving protocol, and professional organizations. HIPAA compliance. The Health Insurance Portability and Accountability Act of 1996 protects patient privacy and regulates patient information sharing. The dentist must follow a specific format when putting HIPAA policies into practice. The dental staff must be informed of specific security and confidential issues. HIPAA-related training of existing dental staff must be reinforced continuously. We want to know the law, adopt or create the required forms, educate dental staff, notify patients of the new policies, and make sure policies are current and fully implemented. Personal issues can be in the main SOP manual or in a separate one. Topics would include job descriptions, hours and pay periods, and benefit information. Some of the business equipment you might see in the dental office could include the telephone, fax machine, computer, and a copier. Computer applications in the dental office could include appointment scheduling, a recall system, electronic patient records, word processing, networking and marketing, bookkeeping tasks, spreadsheets, inventory management, billing and collection, patient ledger, processing of insurance claims, and online communication. Patient dental records would include registration form, medical and dental history, exam findings, diagnosis and treatment plan, record of treatment, correspondence, consent forms, and radiographs. Financial records would then include payments, insurance claims, statements, and reminder letters. These are kept separate from the clinical record. Practice business records include accounts receivable, expenses awaiting payment, expense records, payroll, correspondence, canceled checks, bank statements, income records, financial statements, tax records, and personal records. Basic filing methods include alphabetical, color coding, numerical, and computerized. And guidelines to effective filing include keeping the filing system simple, label folders clearly, leave adequate working space within each file, label shelves or drawers, use out guides, and pre-sort. Active and inactive files. Active files are files of patients who have been seen recently, usually within the last 2 to 3 years. These are maintained in areas of easiest accessibility. Inactive files are files of patients who have not been seen in the last 3 years. These files are maintained in a less convenient area, but can be accessed if needed. Record protection and confidentiality. HIPAA electronic safeguards. The dental office must have a physical and technical safeguard to ensure the protection and confidentiality of the patient's personal information. Protecting electronic files. Back up all files each business day. Keep two sets of the backup files, one in the office and a second outside of the office. Protecting paper files, records are protected in correct file cabinets and are properly closed each business day. Goals of efficient appointment scheduling.